You know that jingle. It means that it's Wednesday and it's time to talk about Just Kids. Now, this morning, our conversation is definitely one that you need to take note of, talking about viruses. Joining us in studio is Dr. Joanne Paul, a specialist in pediatric emergency and a director at Just Kidz Emergency, along with being a lecturer in emergency medicine at the University of the West Indies. And I feel like a little bit more as well, Dr. Paul. Good morning.
Morning. Thank you for having me here. Lovely, lovely.
It's a pleasure to have you with us on the show this morning. Yeah. And again, this conversation is so important because we're talking about viruses. And one of the first things, I know this is resonating through everybody as soon as you mention the topic, is the fact that, you know, we know the pandemic was finished in 2022. We continue to see some viruses coming up, but we've definitely seen some stronger ones from November to now. Is this something that's normal?
Yeah, so good question. Actually, I think it's a combination of stuff. It's really weird. So, you know, after the pandemic, I should go back a little bit. When children are growing up, when they're younger, less than 2 years old, their immune system is a bit immature. So they have to be exposed to all these viruses. So you'll know when they go to preschool, parents tell me all the time, oh my God, Dr. Paul, my child is coming with a virus every month. How can we stop this? And this is normal, as they say, normal, right? So your child has to be exposed to that, and it might be where it lasts for about 6 months. So we didn't have that. I know, 6 months. I know. And I tell them, be patient. You have to be exposed to it. So during the pandemic, we had none of that. So I think in 2022, we had some exposure, but in 2023, we still had those ones coming out. So we have children who still need to be exposed, having lots of infections. And for some reason, I'm not sure, we're having a combination of viruses. So we have the RSV, I know it's all these strange words, but RSV, metapneumo, we have the influenza, all coming together. So we have a post-pandemic population that still needs to be exposed and get reinfected with all these viruses, and a lot more around this time. So around like October, November, we usually have flu season. Now it's exacerbated to December, January, and of course, you know, post-carnival, we go up again. So it's normal. It's exacerbation, but it's still normal. Yeah.
All right. So I'm glad that you also mentioned, of course, going from COVID-19, coming back out, and the possibility of reduced immunity. Is that something that is a factor we need to consider?
Yeah, so the thing is that exactly. So we have remedies for 2 years. So we have all these tranches of children who need to come out. So we did have that, even with adults. So when my doctors come to be seen kids for the first time, they also get infected. So you have to have it where, I think the immune specialists say you must get infected like about 4, 5, 6 times before you build that immunity. And of course we have JN.1, which is the COVID variant. So that's also a factor.
Now, this is something that has been a critical point of conversation, whether it's WhatsApp, Facebook, TikTok, anything you could think of, everybody's talking about that. So what about it? Some are saying that it's worse than Omicron. Is this a fact?
So it's definitely, as of today, don't know if any changes, but as of today, definitely it's the same. It's not worse. It's mild, but it's more infectious. And if you think about it, if I was a virus, I want to go further. So the best thing for a virus, my goal is to infect as much as possible. That's what the virus mutate to. So therefore, as the variants go along, it's always going to be more infectious. So it's not a matter of when you get COVID. It's not a matter of if you get COVID, but when you get COVID. Yeah, definitely. So I think people have to focus on the immune system. They can't go around, oh my God, COVID. It has to be where you say, oh no, I can handle it. And that way you have to build your own immune system, exercise. I know this is stuff we hear all the time. It really works. I'm talking about don't respond to stressors, do your meditation, your prayer, your mindfulness, exercise, even if it's 20 minutes once a day. Maintain manage your diabetes, your hypertension. Try to make sure your health body is as good as possible, and do the normal thing. Wash your hands, coughing too. I know we've been saying this over and over again, but once you can have your immune system really robust, you can handle anything. Even you can handle a crowd carnival and not get COVID.
Wonderful. So we're building immune systems. Now, one thing that a lot of people do when they want to build their immune system is they automatically start to take vitamins. What about children, though? Is this something that you recommend for children to boost their immunity?
So I don't. I usually tell parents that the best thing to do is you don't have to have any extra vitamins. They tell me, what should I use to build them up? Just talk to your pediatrician, have the proper diet, have exercise. Now, obviously, if they're in the household with their video games, there's not an immune system there, right? They must be playing with children, get that exposure, build it up, have germ therapy, just be exposed to lots of stuff, build it up, and you don't have to, once you're feeding them appropriately and exercising, that's enough.
Okay, wonderful. Now, something else we've also seen is an uptick in mask wearing as of recently. Is this something that you would recommend?
I would say it's not for the child, it's for your choice as an adult. If you find that your immune system is a little bit lower for whatever reason in terms of immunosuppression, if you're like your cancer patient or whatever, there are some patients who have that, I would say go ahead, but it's the extra layer. You must do the other things. Build your own innate system, wash your hands, and if you wish to, wear the mask. But you can't be wearing the mask and rubbing your nose all the time. You can't be
to breathe, like
you can't be doing that, right?
Yeah.
So wear your mask, change your mask if you wish to, but even more than that, do the other things to maintain your immune system.
Wonderful. Now, let's go back, of course, to children, as we're talking about Just Kidz, of course, this morning.
Just Kidz.
What have you seen being presented to Just Kidz when it comes to viruses as of recent, let's say?
Yeah, definitely. I think in November, we were seeing lots of diarrhea, but now, as we're coming into Carnival, lots more respiratory. And so I think I'm really an advocate for empowerment by parents. I think they should know everything about their child. And so if there's mostly respiratory, know your child definitely. I say look, listen, feel. So I'm sure you're curious about, I have my little mannequin here.
Oh, yes,
this is
definitely.
little Annie, all right?
Hi, Annie.
So Annie says hi, all right? So the thing is, as a parent, you don't want to have it where the health is only for the doctor. It's your child, your responsibility.
Right.
So you need to know when something is wrong, right? Because mostly respiratory. So I say, look, listen, feel. So listen, first of all, for any songs. You know, if they're making strange, they might be wheezing. They might be coughing like there's this thing called croupy cough where they cough like a dog. And so you listen to that. Or you look also. So I say, look for 4 areas especially.
Okay.
Look at their nose to see the nose is flaring. So it's the same as if we're breathing fast, right? We're like, if you run a marathon, you'll be like exhausted, right? So see how they're doing. Look at the nose flaring. Then look right here by the neck. If it's sinking in, that's a sign I'm working really hard. The major thing I see, look at this V right here.
Right.
Right at the ribs. If you see, because as a child, I have abdominal breathing. So I'm going to breathe with my abdomen. And as I do that, I sink in by the V. So if you see this V coming up really strongly, that means I'm working really hard to breathe. And the last thing, turn me to this side. Look at my ribs. If you find my ribs are sinking in, that means I'm also breathing really, having a hard thing to breathe. So I think they say, when flour more than water. So if you find that it's not just mild, it's moderate, my child is breathing fast. And the last thing, feel. Put your hand right here by where you think the heart is. Usually it's going to be on the left side here. So put your big hand here and feel for that heart rate. You can always tell, right? And you can check it. So if it's a normal for a child, 80, 100. If you find it's like about 150 per minute, or if you listen for about 10 seconds and you feel, and it's about 25 to 30, in that 10 seconds, you know it's too fast. So if you see your child breathing, behaving irritable or drowsy, breathing fast, all those signs, and you're feeling here and you think something is wrong, you're going to call and say, hey, you're not pediatrician, I think something is wrong here. I'm worried about my child.
All right, wonderful. And you're going to call 612-5439. That's 612-5439, Just Kidz. Dr. Paul, any last advice to parents this morning?
Definitely tell them 2 things. Don't worry when they're going to preschool or primary school. Their child, just expect, be patient. Their child will be getting lots of viruses, and that's normal to build their immune system. Expect for the first 6 months. But last but not least, it's your child, your responsibility. Know your child and talk to us. We're here for you. All right.
Definitely. I mean, Just Kidz Emergency Medical is here for you, located at number 10 Broome Street in St. Clair, 612-5439, 322-5749. Tell us, Dr. Paul, one of the things that you mentioned is you see an uptick in respiratory issues.
Yeah.
Is this something that you would say is predominantly at Carnival, or do we see this, let's more say, with the Sahara dust and so forth?
Well, so that's an interesting question. So they found some research, they're not sure about the Sahara dust. If you have asthma already, it exacerbates it, but lots of research in Barbados hasn't been sure. But in terms of the viruses, we're seeing that stretch through viral season to Carnival. So it's not the normal thing, but it's stretching onto. So I'm expecting it's going to go post-Carnival, February, March, but usually you have the upsurge like about a week afterwards. Definitely after Carnival and in March, and then touching to Easter. So yes, so expect all these viruses, man.
All right, and one more quick question for you. Now, you gave us a demonstration with Annie of course, areas to look out for. But would you say that those are indicators of when you need to take your child to the doctor? Because, many times, it's a virus, it's fine. Take this and relax and everything will be okay. So would you say those are indicators that there are more things we should look out for?
So definitely, yes. So what you find with all these viruses, this one right now, you're getting lots of cold and cough, etc. But you have to know when it's going on to wheezing. So what you find is that when it's going on to a chest infection or when they're wheezing, and the viruses now, especially RSV, is very much wheezing for about a week or two.
Okay.
And parents are like, oh my God, what's happening? Again, be patient and know your child and look out for that. So when it's happening like that, it says it's not the normal mild, it's much more. It means call someone, go to someone. And don't go with, I don't know what's happening. Go with attitude. I'm parent, whatever. This is my child, and I've checked all that, and don't do Dr. Google. Just you're the rep at home.
Correct.
Be the doctor, be the nurse, and tell them, check my child, tell me what's up, something is not quite right.
Wonderful. Take ownership and empower yourself.
Definitely.
Dr. Paul, thank you so much for being with us this morning. And Annie, thank you.
Annie says
as
goodbye.
well. Goodbye, Annie. Talking about Just Kidz Emergency every Wednesday right here on the Now Morning Show. We're about to take a quick break and we'll be back with some more. Stay tuned.